Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Sarcoidosis. Introduction. Sarcoidosis can be a lifelong disease. It can start suddenly or slowly over time. Symptoms can affect any organ and may stay for a while and then go away. The lungs and lymph nodes are most often affected. Thousands of people suffer from sarcoidosis. The majority of patients with sarcoidosis can expect to live a normal and active life. Some cases of sarcoidosis are severe or fatal. This program will help you understand sarcoidosis, its symptoms, causes, diagnosis, and treatment options. Granulomas. Sarcoidosis is a disease where granulomas appear in various organs of the body. This section explains what granulomas are. Granulomas are lumps that form when cells of the immune system clump together. The immune system is responsible for fighting germs that invade the body. The immune system is made of special blood cells that destroy germs, such as viruses and bacteria. These blood cells are called white blood cells. There are two types of white blood cells. 1. T cells. 2. B cells. T cells identify a foreign material or germ and attack it themselves. When B cells identify a foreign material or germ, they secrete special chemicals called antibodies. These antibodies stick on the foreign material and destroy it. When T cells and B cells identify a foreign organism, they release chemicals that recruit other blood cells to help destroy the foreign organism. The reaction of the immune system to foreign materials and germs causes inflammation. The inflamed site looks red and swollen. Sometimes all the cells that come to the infection site clump and form a small bump. This bump is called a granuloma. Sarcoidosis. Granulomas that appear in people with sarcoidosis can form in any organ or tissue of the body. The lungs and lymph nodes are the most often affected. Granulomas can also affect the skin, brain, spinal cord, kidneys, and eyes. Most granulomas heal within 2 or 3 years. Treatment may be needed for them to heal. Sometimes the granulomas do not go away. This can lead to scarring called fibrosis. If granulomas keep forming and causing scarring, sarcoidosis is called chronic, which means ongoing and long-lasting. In rare cases, fibrosis that damages the heart or other vital organs can cause death. Most sarcoidosis patients live normal lives. About 6 out of 10 recover on their own. 3 out of 10 have permanent damage, and 1 out of 10 have life-threatening problems. Sarcoidosis usually affects people in their 20s, 30s, and 40s. It is more common in people of Asian, German, Irish, Puerto Rican, African, and Scandinavian origin. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Sarcoidosis is due to an abnormal reaction of the immune system, the part of the body that fights infection. Scientists currently do not know what causes this abnormal reaction of the immune system. Symptoms. The symptoms of sarcoidosis depend on which organ and body parts are affected. In addition, symptoms vary from patient to patient.
If the lungs are affected, patients usually have shortness of breath and a cough that will not go away. If the eye is affected, the symptoms depend on which parts of the eye are involved. In some cases there are no symptoms at all, and in others eye inflammation, cataracts, glaucoma, and blindness may result.
People with sarcoidosis may develop skin symptoms. These include red or purplish patches on the face or legs. Other problems include lumps under the skin or areas of lighter or darker skin. If joints are affected, sarcoidosis can lead to arthritis. Arthritis is inflammation of the joints that causes pain and stiffness. Joints that are commonly affected by sarcoidosis include the ankles, elbows, wrists, and hands. Granulomas caused by sarcoidosis can show up in the brain, spinal cord, and nerves. This could lead to symptoms associated with the nerves involved. For instance, if the facial nerve is involved, sarcoidosis can lead to facial paralysis.
If the liver, kidney, or heart are affected by sarcoidosis, they may malfunction. Symptoms are related to the part affected and to the severity of the disease.
Sarcoidosis may also have general symptoms that are not specific to the affected organs. These include fever or night sweats, weight loss, feeling tired or not feeling well.
Diagnosis.
Sarcoidosis is relatively difficult to diagnose because the symptoms may resemble those of other diseases. Healthcare providers may need to rule out other illnesses to make the diagnosis. The healthcare provider first takes the patient's medical history and does a physical examination. The healthcare provider may also order blood tests. The healthcare provider may take chest x-rays to look for sarcoidosis in the lungs. MRIs and CAT scans can be used for other organs. Several diagnostic tests are specific to affected organs. For instance, a pulmonary function test, or PFT, helps measure how well the lungs are functioning. When a healthcare provider suspects sarcoidosis in a body organ, he or she takes a sample of the tissue to be examined under a microscope. The type of cells in the sample can tell the healthcare provider if there are inflammatory cells and/or granulomas. The site of inflammation can also be found by taking pictures of the inside of the body after injecting radioactive materials. This is called a gallium or a thallium scan.
Treatment.
Since sarcoidosis can disappear without treatment, the healthcare provider may recommend observing the disease and not treating it. Treatment can help with symptoms. The treatment used depends on the amount of inflammation and which organs are affected. Corticosteroid medication treats the inflammation and stops the development of granulomas. Prednisone is a common corticosteroid. Symptoms usually come back when the medication is stopped. Treatment may take years. Corticosteroids can have side effects. If your healthcare provider prescribes corticosteroids, make sure to discuss the potential side effects with your healthcare provider. Corticosteroids should not be stopped without the supervision of a healthcare provider. Other medications are available to treat sarcoidosis. Hydroxychloroquine, which is used to also treat malaria, can be helpful in about 1 out of 3 patients, especially those with skin involvement or high levels of calcium in the blood. One of its side effects is that it can damage the eyes. Therefore, eye examinations should be done every 6 months.
Methotrexate, azathioprine, and cyclophosphamide are medications that affect the immune system and tend to help with sarcoidosis. They do, however, have some significant side effects, including causing abnormalities in unborn children and increasing the risk of some cancers.
Tumor necrosis factor alpha, TNF-alpha, inhibitors may also be tried when other treatments have not helped. This medication can help lower inflammation. Frequent checkups are important so that the healthcare provider can monitor the illness, the organs affected, and the side effects of treatment. Depending on these factors, treatment may be stopped or adjusted.
Fibrosis from severe sarcoidosis cannot usually be reversed. If the patient has too much calcium in the blood, his or her healthcare provider may suggest dietary changes and avoiding sunlight.
As a last resort, a lung transplant may be done.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Sarcoidosis is a disease due to inflammation of body tissues. Small lumps called sarcoid granulomas may form that can leave scars in the affected organs. In most cases, granulomas disappear and do not come back. If they do not disappear, they may cause symptoms, depending on the affected organs. Since sarcoidosis can disappear without treatment, the healthcare provider may recommend observing the disease and not treating it. Thanks to medical advances, effective treatment is available for those who have sarcoid granulomas that do not disappear on their own. Most patients with sarcoidosis can expect to live normal and active lives. Thank you for using Explain.